Welcome to The Better Life with Dr. Marianne Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Marianne Pinkston.
Hello, everybody. I am Dr. Marianne Pinkston, and this is The Better Life with Dr. Pinkston. And today I have another wonderful guest and such a lovely energy and soul. I'm gonna do this as best I can, Hélène Bertrand, and I'm gonna say Bertrand with that terrible Texas accent. You are French, I think, and can say your name so much more beautifully than I can, but I am excited to have you on today because and most of my audience knows chronic pain is very, very near and dear to my heart. I've had rheumatoid arthritis for 20 years, amongst other things, amongst other aches and pains all over. So pain is near and dear to me, and I want to bring some ideas for pain relief to my audience out there. And I am so honored and happy to have you on. Welcome. It's nice to see you.
Well, thank you for having me over, Miriam. It's a pleasure to see you this morning.
Thank you. Well, and so this is usually a great opportunity for my guests to explain your story, who you are, what you've done. You are a physician, what you've done and how you've come to be and some of these great things that you have developed. And so take it away. Tell us all about you.
Well, my story started when just after I finished my internship, I was pregnant with my first child. And the back pain I got was good, awful.
Yes, ma'am.
And when I finally delivered my baby, the back pain didn't go away. And so it was so bad. Like, for instance, if I wanted to take her upstairs, I'd have to hold her in my arms and sit on the steps and push myself. I could not walk upstairs.
Sure.
When I tried to roll over in bed, it was like I woke up because the torture was awful.
Sure.
And that back pain stayed with me. Sometimes it was better, sometimes it was worse. It stayed with me for 39 years.
Wow. And
one day I was at a course on the diabetic foot. And I was with a friend of mine, Marianne. As I was sitting down, my pain got so awful. And I said, oh my God, my sacroiliac joints are killing me. And he said, come and see me. I'll do Prolotherapy on you. I said, Prolo what? That was in 2003. People didn't do Prolotherapy yet.
Correct.
And so he essentially, I went to see him, and he gave me these injections of sugar water where the ligaments that are stabilizing my sacroiliac joints attach on the bone because ligaments don't have a blood supply, so they can't fix themselves.
Correct.
That's why I kept having pain.
Yes.
And so when he gave me those injections where the ligaments attach on the covering of the bone. And you know what's inside the bones is your bone marrow.
Right.
So when those injections went where there was a whole bunch of blood vessels to get all the new cells that were being made by the bone marrow, when they created a small injury there, then I grew new blood vessels into the ligaments. The new blood vessels were bringing repair cells to where they were needed.
Correct.
And the repair cells made scar tissue there, so they deposited collagen.
Yes.
And sure enough, in 3 treatments given a month apart, I stopped having back pain.
Wonderful.
Wow.
Right.
So
right.
I was so excited. I was so excited. I wanted to know how to treat all my patients with Prolotherapy.
Mm-hmm.
So he came every Friday and gave me, I would have 7 or 8 patients with joint pains. And he gave me these talks on how to fix people with prolotherapy.
Wow.
Problem was that that's a bunch of injections. And
Yes, tough.
A whole bunch of people don't like injections.
Correct. Correct.
And so I had to find other ways to help them. And so, and after a while, my back pain was coming back again. And I thought, oh my God, what am I going to do?
Mm-hmm.
I remembered my anatomy lessons.
Mm-hmm.
And I remembered that the pelvic bones are what carries the whole weight of your body. We're not like all the other animals are horizontal,
right? On 4 feet instead of upright on 2, and right.
Well, on 4 feet, the weight of your body is on your spine, but when you're upright, the weight of your body is on those 2 bones on either side of your waist, called the pelvic bones.
Right.
The pelvic bones, they form like a funnel to hold the weight of your whole body. Mm-hmm. And unfortunately, that funnel opens up when you're lifting weights, or when you're overweight, or if you're standing for too long, or you're sitting for too long. This will open up the joint that holds those pelvic bones on the back of your body, on your sacrum, that little triangular bone at the back of the body.
Right.
So that's when I realized that you have to fix the pelvic bones. Mm-hmm. But how do you know how to fix the pelvic bones?
Correct.
And I thought, well, can you see those bones? Unfortunately, they're invisible. Do you know why? Because your hip joints are inside your pelvic bones. Mm-hmm. Every step you take draws that pelvic bone and that joint. And because of that, you have essentially, the joint is your body's shock absorber. Mm-hmm. So all the other joints in the body are nice and smooth. They're easy to see with x-rays, CT scans, MRIs, ultrasounds. But the sacroiliac joints are invisible because they're your body's shock absorber. Mm-hmm. And because they're a shock absorber, they're full of bumps and hollows because they're trying to prevent that shock from affecting the rest of your body. Mm-hmm. Because they're so irregular, they're invisible to x-rays, CT scans, or MRIs. So I figured the only way you'd find them, and by the way, I graduated from medical school in 1965. In those days, you didn't have
the technology.
MRIs or ultrasounds or CT scans, all the x-rays.
And physical exam, which is lost, and a lost art in these days, physical exam.
So the only thing you had were your eyes, your ears, your mouth, and your fingers to find out about your patients.
Correct.
And that's when I decided to examine the pelvic bones. And doctors nowadays don't examine the pelvic bones.
You are correct.
In fact, they say that bones, that pain coming from that area is non-specific, which means we don't know. And if it's non-specific, the treatments are going to be non-specific. And if the treatments are non-specific, they're not going to address the problem. And so the important thing to learn how to fix your low back pain is to use your fingers. And if you don't mind, I'd like to show you how to use your fingers.
Absolutely.
Okay, so I'll get them off my chair. Okay. these, you see, this is the top of your pelvic bones. Your pelvic bones are huge. You see, this is the whole top of your pelvic bone.
Correct.
And the end in your sits bones right here.
Mm-hmm.
Look at how big they are. But this is what you need to know. You need to feel, you see how the top of the pelvic bone ends here?
Mm-hmm.
Okay.
You can feel that lump. You can feel that ridge.
Feel a bump, a ridge.
Yes.
Here, a bony
Yes.
ridge, okay? And if your fingers meet each other, which mine do, there's no problem. But if there's one spot just underneath that ridge, if there's a spot that hurts here or there, then you know that that joint is out of place.
Mm-hmm.
And if it's out of place, you need to know how to put it back.
Correct.
It's that simple. Do you want me to demonstrate?
Yes. Absolutely, please. Absolutely.
Okay, so say this finger is too high and this finger is too low. Okay, so the fingers are not meeting each other anymore. And you've got pain underneath both of these. So then you need to use your thigh to put the one that's forward. You want to push it backwards.
Mm-hmm.
And you need to use your thigh to pull the one that's backwards further forward.
Mm-hmm.
That's all you need to know. I've written a book about it,
Yes.
and I'll show you. In the book. Okay, so essentially, if you put these fingers back where they belong, you'll have immediate pain relief. But
Wonderful.
those bones move very slowly. So
Yes.
in order to put it back, it takes a good 2 minutes. You have to hold it for 2 solid minutes.
Correct.
If you hold for 2 solid minutes, then you have a 90% chance of having 0 pain when you get up.
That's amazing. And I'm assuming, too, you probably need to do it periodically because it's going to try to go back, right? So do you need to do it?
Well, the thing is that if your ligaments are loose, that's when the joint is loose.
Yeah.
So if you've had a motor vehicle accident with your foot on the brake,
Right.
or if you've had a baby and the ligaments haven't tightened up again, or if you're older and the collagen in your ligaments is getting less like the collagen around your skin is getting less, then you're going to have to find ways to put those ligaments back in place or to put those joints back in place. And I'll show you what I use for my chair.
Good.
Okay.
Nice.
This is called a donut.
Yes.
Because it looks like a donut.
Because it looks like a donut.
And you see, if I'm sitting, I can't. These are my sits bones that you can see here. Okay, my sits bones can't spread away from my sacrum, and so my pelvic bones can't spread away from my sacrum because it holds the sits bones.
Okay,
so that's one way to
very good.
protect yourself.
Very good.
The other way is something that I can show you. It's called a pelvic support belt. Have you ever heard of a pelvic support belt?
Oh yeah.
Okay.
Now, writing all this down, so this will go on the website and everybody can access
This
information.
Okay, this is how you put on a pelvic support belt. Remember, it's not supposed to go around your waist. If you put it around your waist, it'll make you worse.
Okay.
This is how you put on a pelvic support belt. You put it around those joints that you've just felt.
Okay.
Remember those two little bumps?
Just underneath, right? And
So underneath those two little bumps, you have to put it around those joints, and then you make it even tighter.
Okay.
To make sure that that joint is held together. So those are ways, but obviously the best way to fix it is to get prolotherapy.
Okay.
Now, in the U.S., in the prolotherapy, prolotherapy is called orthopedic medicine. It's not surgery. It's medicine, because what we do is injections.
Yes.
So you want people to find the Association for Orthopedic Medicine.
Okay.
And these are doctors who know how to do prolotherapy.
Okay.
And that's something that I would recommend. Or the Canadian Association for Orthopedic Medicine.
All right. Very good. Now, I will make sure that everybody has a link to be able to find that, because you mentioned in the beginning it's sugar water, but it's really mannitol, right? The type of sugar is called mannitol, which is used in a lot of medicine, but very interesting and specific here. Well,
the thing is that before we talk about mannitol, I'd like to tell people about my book.
Oh, yes, absolutely.
Low back pain, 3 steps to relief in 2 minutes.
Absolutely.
Because that's all it takes is 2 minutes. Yeah. And in the book, there are QR codes that tell you all about what you need to do and show you. So they take you to videos that show you.
Beautiful. Very good.
How to do it.
Very good. Oh, you did good. Very nice. When did you write this book?
I wrote it in 2020. I started writing it in 2023 after they kicked me out of the Canadian Pain Society.
Oh, no. Probably because you were doing something right.
Well, the thing is that I was, they were presenting this woman who had 20 years of low back pain, and nobody was able to treat it. And it was terrible, and it was non-specific. And they were wondering about narcotics and about surgery and so on. And so at the end of the talk, I said, has anybody checked the level of her pelvic bones? Silence.
Yeah.
And I said, well, if you know in what direction the bone is displaced, then the treatment is obvious, and it only takes 2 minutes, and it has a 90% success rate. By the way, I did a randomized controlled study on that one.
This is very scientific. Absolutely. Yes.
I proved it.
Yes.
And it immediately shut me out of the system.
Yeah.
And that was a Zoom call. They shut me out of the call. And the next day they sent me a message saying that if I was never to mention this again.
Wow.
Ever.
Wow. And so typical for the way, contemporary medicine is. It happens to people all the time. When you have a good solution, something natural, something, truly effective that goes against the grain, it's.
Well, the other thing is that in September, I shut up. I mean, I didn't want to be kicked out of the Pain Society. But in September, they were talking about narcotics and side effects and so on. And I thought, I didn't say anything, but in the chat, I put, there is a new treatment for low back pain, interested, ? And I put in my email.
Sure.
Immediately, I was shut off the Zoom. Yeah. And the next day, the president of the Canadian Pain Society said that I had broken my word and I was never to participate in any of their meetings in person or on Zoom. That was it.
Understood.
I was kicked out, so to speak.
I'm so sorry.
And that's when I decided to write the book. I thought, okay, you guys don't want to know about it. I'm telling the whole world.
There you go. That's my girl, a fighter. I love it. I love it. Bless your heart. I'm sorry you had to go through all that. Well, this sounds like a fantastic treatment, and I know that you have. We'll probably get into it in the next set, but I know you have other pain treatments that you have developed as well.
Oh yes, in the last. I've invented a lot of things, a lot of new treatments. In fact, I invented another one 2 days ago, but this is something else. Okay. But in the last 12 years of my 55-year medical practice, all I did was treat patients that were referred to me by other physicians because their pain was intractable. They had pain that nobody could control. Correct. And 80% of them left my practice with little or no pain at all.
80%?
80%.
Nice.
I keep statistics, believe me.
Sure you do, as you should. And so beautiful. What a beautiful career to have treated and taken care of so many people and their suffering. And that's why I'm, of course, because, here with the rheumatoid arthritis is what I've had for 20 years. But I know that there are so many that have, multiple reasons for having joint pain, ligament, tendon, muscle, pain, bone pain. There's just you said and mentioned before we actually got started that there were 289 different types of pain treated by your therapy.
That was treated with this cream that I invented.
Mm-hmm. Yes, ma'am.
Essentially, I started inventing this cream. I was injecting people around nerves with a totally natural substance called mannitol.
Correct.
Every plant and every mushroom has mannitol because it's antioxidant. Mm-hmm. And it kills germs. It's a sugar alcohol. There's sugar molecule with one OH. And because it kills germs and it's an antioxidant, every living thing wants mannitol.
Sure.
And we use it in medicine to shrink swollen brains or to reduce glaucoma or to help clear blocked kidneys.
Absolutely.
So it was used intravenously for that. And by the way, you have some chewing gums that have mannitol too. Because
that's correct.
It's a sweetener. It's a sugar derivative. So I was, at first I started injecting around nerves with sugar because there was a Dr. John Liftoft who'd given talks about injecting sugar around nerves.
Right.
At first, that was at one of those American orthopedic medicine conferences. Mm-hmm. At first I was shocked. I mean, like sugar around nerves.
Right.
But then at the end of the one-day seminar that he gave, he said, anybody here has severe, chronic, untreatable pain? Mm-hmm. And people put up their hands.
Mm-hmm.
So he said, well, come on up here and we'll see. And he injected around their nerves.
Uh-huh.
And instant pain relief. Like all 7 of them, like one person had a migraine headache, one person terrible shoulder pain, another one had burning feet from diabetic neuropathy, like one of them had terrible arthritis in the knee. He injected around the nerves and poof.
Done.
And I thought, oh boy, I've got to do this in my office. So I come back to my office. I started injecting people with this sugar solution around the nerves. And then I thought, there's a whole lot of diabetics here.
Yeah,
I don't want to make their nerves worse by putting sugar around them.
Correct.
Diabetic nerves get injured by sugar. Mm-hmm. And so I thought, I've got to try something else. And the other thing that I thought was, well, why don't we try mannitol? Mannitol is a sugar with 1-OH, but it does not damage the way sugar does.
Correct.
And so I I started using mannitol.
Right.
And that's when everything happened. It was very, very exciting.
Very nice. Oh, I can imagine your elation to see people get better so quickly. And we'll probably take a short break here, and I will have you come back, though, when we get back from the break, discuss your cream and how that came about, because that's a beautiful story. And so please tell me, though, or tell my audience where they can find you, your website and your book and everything. All this will be on the website.
I have a website, and here it is.
Yes, ma'am.
If you go to nopain.ca, no-pain.ca, you can go to my website, and I'm giving talks on how people can relieve their pain naturally. And I'm giving those talks. The first one is going to be a free webinar on September 24th.
All right.
And the second one is going to be a 7-week course where those who sign up for the course will have a talk about different parts of the body, how you can relieve the pain, say, from a headache or your neck or your shoulders or your back or your knees or your legs. And I'm going to give 7 different talks. And at the end of each of these talks, I will be teaching people. I'll be sort of talking with them, and that will be private.
Okay.
The course itself, they'll get a copy of the course.
Okay.
But the way I deal with each one and their different issues is going to be totally private.
Nice. That's so nice. Oh my goodness. And when does that start?
That'll start on October the 8th.
October the 8th. Okay. I want to make sure we get all of this out in time for you and get
thank you, Marianne.
Get that advertised for you. And so that is wonderful. Okay. Well, then, of course, everybody can find this show and information on all of her courses and books and everything at drpbetterlife.com. And we're going to take a short break and be right back and talk a little bit more about your pain cream. I can't wait.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Welcome back, everybody. I'm Dr. Marianne Pinkston here at The Better Life, and I'm talking with Dr. Hélène Bertrand. And I'm embarrassed to say your name because you say it so much more eloquently with your beautiful French accent. And so I apologize for ruining that. But we've been talking about your pain, your ability to relieve pain with your injections. And now you have a pain cream also. You've got a lovely story behind how you came to develop this and find it.
Well, I was telling you about Dr. Liftoft, who gave that talk on sugar, and then I started injecting people with sugar and thinking, oh my God, I can't give this to diabetics. And I had a lot of diabetics who had burning fingers and burning feet. I just couldn't do it. And so then I started to use mannitol, which has been given intravenously. And so that was working really well. I mean, I would inject, say, around the nerve that was going to a painful area.
Mm-hmm.
And even before the needle was out of the skin, the pain was gone completely. And there were, by the way, there were a lot of doctors and a lot of pharmacists who came to my practice because I was getting really good results and they wanted to see how I was doing it. And there was this pharmacist, Marianne Pinkston. She was observing me and she said, I've never seen pain go away so fast and so completely. But she said, people don't like injections. Why don't we make it into a cream? I said, sure, let's make it into a cream. That was not so easy.
Yeah, I'm sure.
We had to try 16 different base creams before we found one that allowed the mannitol to penetrate through the skin and to reach the nerves, because mannitol shuts down the pain messages that the nerves are sending to the brain.
Nice.
And so when I finally found that base, I started testing the mannitol on all my pain patients, those that had headaches or pain in the neck or knee pain or foot pain. I tested it on everybody. And it was amazing. What I would do was I would give them, like Marianne was making the cream in her kitchen.
As all things start, yes.
And so I didn't have that much. So I gave them a little container, the 50 grams, 2 ounces or less than 2 ounces of that cream, and the questionnaire. Okay. What date is it? What time is it? How bad is your pain right now? How bad is it? From 0 to 10, give me a score. Right. And then half an hour later, how bad is your pain? And how long did it take for the cream to start working? Yes. And how long did it work? And so they filled out that questionnaire. So I've got 289 questionnaires. 35 people, but some people had, say, headaches and knee pain, or they had pain in
multiple areas.
So I had 289 questionnaires, and so I found out from the database that cream provides an average of 53% pain relief. That's the difference between now and 30 minutes later.
Gotcha.
And that's, 53%, that's not 100%, but narcotics will give you 36% pain relief.
Thank you.
And anti-inflammatory medications will give you 23% pain relief.
Absolutely. And 53% for those, you're right. It doesn't sound phenomenal, but it is. And I can tell you, as somebody who suffers chronic pain, that if you can give me 50%, pain relief, you will change my life. You will change the quality and the everything that I'm able to do daily significantly. And so that is a great percentage.
Well, anyway, I started using the cream, and I was getting a lot of good responses. But then I needed to have statistics. I needed to have proof. And so, and my patients would come back and they'd want more of the cream. And Marianne was making
it as fast as she could, I'm sure.
She could. And so I said, well, if you want more of the cream, you're going to have to be part of my research project.
Nice.
They all agreed.
I'm sorry.
And so what I did was I put some hot pepper cream on their upper lip.
Mm-hmm.
Do you know hot peppers, how they feel?
Mm-hmm.
Okay.
Yeah.
And it's called capsaicin. Okay.
Yes.
The hot pepper cream burns.
Yes.
When the burning reached 8 out of 10,
Mm-hmm.
okay, like it was burning, then I removed the capsaicin cream,
Mm-hmm.
and the pharmacist was handing me a pink Q-tip for the right and a blue for the left. So I didn't know what I was putting on.
Okay.
But on one of the Q-tips, there was the base cream.
Right.
And on the other Q-tip, there was the base cream and the mannitol.
Okay.
The person I was applying the creams on didn't know what I was putting on.
Right.
I didn't know what I was putting on. And they had to fill out a graph, a questionnaire, with their level of pain.
Mm-hmm.
Every minute, they had to fill out their level of burning because capsaicin burns.
It's tough. Yep.
So, and they had to fill it out on both sides.
Mm-hmm.
So by 3 minutes, the probability that the two sides were the same was less than 3%.
Wow.
That is very good.
It is.
By 10 minutes, every single person knew which side had the mannitol, because on the mannitol side, the pain went like this.
Right.
And on this side, it went like that.
Yeah. Yeah.
So the probability that the two sides were the same was less than 1 in 1,000.
That's amazing.
Every single person knew which side had the mannitol. So I proved that mannitol shuts down the capsaicin receptor, which is the main pain, itch, and inflammation receptor on your nerve.
Yeah.
I know that capsaicin can relieve pain, itch, and reduce inflammation.
Correct.
So essentially, this is a cream that contains capsaicin.
Yeah. Okay. Very good.
And it works exceedingly well.
Wonderful. Well, I fully intend to have all of that information on the website so that people can access this. And I am going to need a bottle myself, actually, or a canister myself, because I would love to try this. I think this is wonderful information. You have such a beautiful energy. Thank you. It's been such a lovely, lovely discussion with you about this. And I think your work is impeccable. Thank you.
Marianne, the other thing I want you to know is that when I give this course,
yes,
the 7-week course, I'll be telling people a lot more new ways to treat pain, not just how to relieve migraine headaches or how to, but for instance, how to realign your legs to treat arthritis.
Yes.
These are things that people can do at home.
Yes.
To fix themselves.
Yes.
For instance, people can make their own orthotics out of Kleenex and duct tape. Mm-hmm. And I'm giving a whole talk on how people can realign their legs, readjust their feet, just because people need to know all these things.
Yeah, it's tough to get good information out there, and from your own doctors, which, I always have to throw the disclaimer in. Please ask your physician if you may, use this and do these things, and if this is appropriate for you. So I always have to use those disclaimers. But I think that it is wonderful for people to have some knowledge that they can carry forward and do not get from their clinic and their physicians, and take some control and advocate for themselves. So you've been beautiful about handing that gift to people. I think that's wonderful. Thank you for doing so. And
thank you for letting me tell people about it.
I want
the world to know it before I drop dead.
Stop. Well, you have to share this. That's why we were here. you are doing what you're doing and I'm doing what I'm doing. And that is to definitely leave a legacy. We've been able to help people and you've done a wonderful job of that. It's wonderful. Thank you so much. And I appreciate you being on today. We are probably going to go ahead and wrap up, but I want people to know where to find you and where to find your information. Give us show your sign again. If you're not on YouTube, you can't see your beautiful sign she made, but all of this information will be on the website.
Because this is an easy way to reach me, and my book and my cream are available.
Yes,
on they're available on Amazon, so they're easy to get if you want.
Very good. I will make sure all of this is on the website. So go to drpbetterlife.com. You can find out more information about the good doctor here and all of her courses, the course that you're going to have, the webinar, the course, her book, cream, all of these wonderful things. And Dr. Bertrand, thank you so very much for being on today. It has been such a significant pleasure and an honor. You're such a wonderful person.
Very much, Dr. Marianne.
Thank you. All right, everybody, I hope you have a fantastic week. Please take care of each other. And until next time.
You've been enjoying The Better Life with Dr. Marianne Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.